It's my pleasure now to ask Barb Whalen, Barb, to come up and introduce our guest speaker today. And I am delighted to introduce Barb, of course, and also to say thank you to Dr. Sean for taking the time to come out on a Sunday through the slush and all that to come and talk to us about the Point Roberts Clinic and what lies ahead. So, Barb, if you'd like to come up and...
Well, it's a great pleasure for me to introduce Dr. Sean, who is one of the people who created SuperTrack Urgent Care in Bellingham. He and Dr. May together created this. And they have now taken the contract, as most of you must know from the newspapers and all the things we've put out. They've taken the contract to run our clinic here on the Point. And the clinic opened in the beginning of January under their auspices, and with Deb as our PA here on the Point. So, and she's doing an amazing job, so if you need to be seen, call and get an appointment with her. But as far as Dr. Sean is concerned, he has an enormous background in healthcare, and so we're very pleased to have him at the helm of this, he and Dr. May. And he can probably tell you more about himself than I can, and he probably doesn't want to say anything about himself. So I'm just going to let him come up and talk to you a little bit of education for the community, which is one of their goals, is to have intermittent education, health-related education for the public here, and also a little bit about what the goals are for the clinic. Okay, Dr.
Hello everyone. It's really my pleasure to be here. It's a beautiful day. We have a beautiful sunny day in Point Roberts. I live in Bellingham with my family. My wife is also a physician. We have 3 children. My wife and I met in high school on the east side of the mountain in the Okanagan Valley, and then from then we've been together. And we went through medical school together at UBC next door. Then did my residency at the University of Toronto, and after that, Kelly and I moved to Illinois for 14 years, where we had our 3 children in Illinois, and then we moved back to the Northwest to Kelly's mom got sick, and we moved back here to take care of her. But we've always thought that Northwest is really home for us. So we live in Bellingham with our 3 children. We have twins, a boy and a girl, Cyrus and Sarah, and they're both in grade 12, and they're doing the running start at the Whatcom Community College. Sarah is right now in New Zealand, and she's doing study abroad. And Cyrus is our boy who's always on the computer playing video games. We can't get him off that. And Alva is our oldest daughter who's going to school in Vancouver. So, I wanted to make this, by the way, I was moved by Chris's introduction of this great project, and I want to tell you it's really wonderful. What you said about your mom, I think applies to so many people. They like to maintain their independence, they like to stay in their own environment, and I like to say I'm going to sign up on that sheet to be a volunteer. And there are so many fringe benefits. I thought, wow, even if you hadn't offered them, I would have still signed up. So I wanted to tell you, this is all about you. So I want to be of service to you. That's the whole spirit of the clinic on the Point. And I like to tell you, you have an amazing advocate. Barbara has been really amazing. She's kind of kept me on track. She's kept other people on track, and she's always politely nudging me and others to do our job. And I really appreciate that. I think she's a fierce advocate for Point Roberts. I also wanted to thank Deb. I think we were blessed to have Deb and also Virginia Lester, whom I have consulted with, because my wife introduced me to Virginia, and I think that Virginia has been an amazing also resource for us. So thank you guys. Deb, thank you. So I'd like to, they wanted me to give a presentation on a certain topic for you guys. And I think because this is the first one, I took the liberty of just choosing a topic. But from this point forward, I like to actually do the topics that are important to you. So just think of me as, well, we have a doc and we're going to basically ask him anything we want, and he's ours, and every so often he's going to come in here, answer all of our questions, and talk about anything that we like to hear. If it's not my area of expertise, I will go find out, and I'll bring you the best information that I can. I have personally, my area of expertise is in emergency medicine. So I'm the director of the emergency department at United General in Skagit Valley. So I live in Bellingham, but I commute to Skagit to work. And then we have a clinic in Bellingham. So my background is emergency medicine. I've been practicing medicine for 20 years. So it's still a very humbling job, you know, it humbles me every day, you know, but I have learned a lot, so I can probably do a really pretty good job at the kinds of questions you guys may have about medicine anyway. So that's my background professionally. I believe in a strong spirit of volunteering and helping. You know, I have done more than 20 missionary trips to other countries. I have taught medical students in the northeastern Afghanistan. I have been in places where we had to use you know, a device that was connected to car batteries to shock somebody's heart back into life. So I feel strongly about education. You know, I have two areas of importance to me personally. One is education for drugs in high schools, and the other one is the homelessness issue that we have in the state of Washington. So those are the two things that I have that I like to give back to our community in Bellingham. But I feel like this kind of an event is really an important thing as well for me personally. So you have my commitments in terms of coming here and talking about the things that are important to you. So today, by the way, any questions about who I am or my background or anything? No? Okay. So I wanted to tell you about the clinic, okay, and then we can talk about the topic. When Barbara reached out to me, I came and saw this clinic, and I kind of geographically, I kind of thought that it's really important for us to keep people independent. And as much as I love the community in Bellingham, the medical community, and all the resources, I kind of feel like if we can keep everybody close to home here, that would be really an awesome thing. Because going through two borders, and just the way geographically Point Roberts is situated, I feel like it's important that we can do as much as possible here on the Point. So that is going to be the spirit of how we move forward and what kind of decisions we make with the community in regards to their clinic. So I think that there's a lot of, right now there's a lot of technology out there, especially telemedicine, which can connect us to the mainland and even connect us to people's homes, you know, and for this project of doing home health or home care here on the Point, also that's important, where you can have someone going to the home to check on someone, and then they can connect with a physician or a nurse or a physician's assistant and say, hey, what do you think about this? Do we have to transfer this patient into the clinic, or can we manage at home? So I think that whole concept of telemedicine is something we like to explore here on the Point and try to have, expand the services using telemedicine. So the other thing is independence when it comes to, testing. Right now the clinic doesn't have an X-ray machine. I think it's important for us to work towards that goal of having an X-ray machine. Our lab, I think, was much better when Mr. Lester was alive and he was running it. But right now I think we should try to build that back up. And I think it's going to take some time, but those are the kinds of things that I see in the future of this clinic. And of course we have to work through the maze of legal issues and licensing issues and regulatory issues. But I feel like that's where I see us moving towards. And that's, I think, what the commissioned once for this hospital district and for this clinic, and I would imagine that's what you guys would want. And all of that is also aligned with the circle of care concept of keeping people close to home. So there's a lot of great specialists and services that are offered in Bellingham. We're going to have to tap into that. We're going to have to cross those borders. However, if we can do more here locally where you don't have to go through those borders and go through the drive, I think that will be the best way to do it. So anyways, I like to, I created a slide set here for you guys. I'm very sorry. I should have called to see if there was a way I could project these slides for you, but there isn't that right now, so I'm going to just improvise. From time to time, I'm going to look at my slides here, and I apologize for that. So it might look a little bit interrupted, but excuse me, next time we'll do a better job.
Duly noted.
Yes. So, can we move forward then? You guys all good with that? Okay. So, when I was thinking about what topic to talk to you guys about, I wanted to make it, a topic that affects your health, a topic that I can talk about in a short period of time, and a topic that we can make, with some recommendations, make a difference in your life if you're already not doing it. So we picked the topic of vitamin D, and that's actually Dr. May Laurie picked the topic, and I thought, wow, that's a great topic, because at Point Roberts, you guys have 156 days of sun every year, and the vitamin D is called the sun vitamin, because our skin actually makes vitamin D when we are exposed to the sun. So the national average for sunny days in the US, do you guys know what it is?
No.
I have to look at it. It's 205 days. So we are like 60 days below the national average. So that means that, many days, you don't get enough sun exposure to make enough vitamin D. So what is vitamin D? So vitamin D is not just a vitamin that helps with our cells working well. It's actually, in a way, works also as a hormone. And the first thing that comes to mind is actually the way vitamin D affects our bones. So it's really important for our bones staying strong. But the interesting thing about vitamin D is that now we know that it also affects the rate of cancer. So it reduces the incidence of cancer, especially prostate and breast cancer, and also colon cancer. It's been now linked to depression. So if your vitamin D is low, you're at higher risk of depression. And it works on also your immune system. So if you have enough vitamin D, your immune system is stronger. So we know that lack of vitamin D can cause some autoimmune disorders. So this vitamin D is a big deal, and right here at Point Roberts, we don't get enough sun to make enough of it. And it's really hard to actually absorb vitamin D, or I should say there's not enough in our diet to meet the demand of our body. So we fortify our milk. It's a rule for all dairy companies to fortify their milk with vitamin D. They add some vitamin D to it, but it's not enough. So fatty fish has vitamin D in it, and beef liver has vitamin D in it. So when was the last time you guys ate beef liver?
I like it.
Well, vitamin D, there's a good reason to eat maybe more beef liver. But, so there are two kinds of vitamin D. One is a D3, and it's animal-based, and one is D2, and that's vegetable-based. So for those of you who are vegan, you can actually take the vitamin D2 instead of the D3. So we have two, if you go to your doctor and you say to them, hey doc, can you measure my vitamin D? This guy showed up at our gathering and he told us how important it is. Or you can go to Deb and ask her, can you measure my vitamin D? They're gonna use two terms. They can tell you you have vitamin D insufficiency or you have vitamin D deficiency. So the insufficiency is like when you actually are a little bit, your tank is a little bit low, you know, but it's not really bad. So that's usually, we measure this in nanograms per ml. You don't have to worry about the terminology. You can just remember the number. So from 20 to 30, you're deficient. Below 30, from 20 to 30, you're insufficient, but below 20, you're in the deficiency range. So remember those numbers, and those are the units we actually use. So if Deb comes back and says, oh, okay, your vitamin D level is 12, that means that you're really deficient. So consequences of vitamin D deficiency: diabetes, high blood pressure, depression, fibromyalgia, chronic fatigue syndrome, osteoporosis, neurodegenerative diseases, autoimmune diseases like multiple sclerosis, dementia, and certain cancers, as we talked about. So there's a wide range of things that can happen when you don't have enough vitamin D.
I can't remember all of them.
So on a day like this, if you guys want to make some vitamin D, you want your skin to make some vitamin D, first of all, you need direct sun exposure. If it goes through the glass, most of the kind of light that you need to make the vitamin D gets stopped by that. So you need direct sun exposure, and you need about 15 to 20 minutes and 40% of your body exposed, okay? So be careful, don't flash your neighbors, you don't want people calling the police on you. But you want to maybe perhaps have your torso exposed and your face, you know, and you know, you need at least 40% of your body surface area to be exposed to the sun for at least 15 to 20 minutes. Dark-skinned people may actually need more. So the more melatonin you have in your skin, I have a little bit more melatonin in my skin than most of you guys. So then for me, I need more exposure to the sun. So I don't have any numbers in that, but it's probably a little bit more, you know, like if 20 minutes for somebody from Anglo-Saxon, Western European background, it's probably like 30 to 40 minutes for like maybe some of the Asian folks, and maybe more for somebody from Africa. So obesity, so fat cells sequester vitamin D. So if you are obese, you also need more exposure because your fat cells pick up the vitamin D and don't make it available to be used. So that's one of the things that also changes your how much you need in vitamin D. People with kidney disease, liver disease, and inflammatory bowel disease like celiacs need more vitamin D as well. There are certain medications that if you take those medications, then your vitamin D level is going to be lower and you need more vitamin D. So steroids, you know, seizure medications, and laxatives are some of those three big classes that actually doesn't allow you to build in high enough levels of vitamin D. So where does one get vitamin D from in their diet? So egg yolk, fatty fish we talked about, fortified dairy, you know, most of the milk you buy has vitamin D in it, and beef liver. But the bottom line is that you guys are going to have to supplement your diet with vitamin D, especially during the winter when the sun, you know, we have less sun here than normal. So then the next, I guess, good question would be, you know, how much is a good amount to take? So, you know, usually about 1,000 units to 2,000 units of vitamin D3 is sufficient in the winter time to help you guys build your level high enough that your body will function well. So, just, you know, little gel caps, vitamin D3, 1,000 units a day is all you need to take. Add it to the list of your other vitamins. By the way, vitamin D is fat soluble and it stays in your body, so if you take too much, you can actually get toxic. And some of the symptoms of toxicity are nausea and vomiting, constipation, itching, and irregular heartbeat. So if you go to your doctor and based on your level, they may actually give you high doses, but it's really, it's something that has to be tailored to your needs. Okay, so if you go, you know, my wife says some of the patients that she treats, she gives them like weekly vitamin D levels of 50,000 units. That's a pretty high dose for several weeks until she gets them up, and then she tapers them down. So I don't want you to think that too much of a good thing is a good thing. It's actually too much of vitamin D can be a bad thing. So follow the instructions of your provider, and don't tell them that Sean said, well, 1,000 is all I need. You know, so let them do their thing. You know, there are times where they give you a lot more than 1,000 units per day. So who should not take vitamin D? People with tuberculosis should not take vitamin D. People with cancer that is spread to the bone, metastatic cancer, should not take vitamin D. People who have sarcoidosis should not take vitamin D. And those who make a lot of kidney stones have to also be careful with vitamin D. So it's not for everybody. If any of those conditions you guys have, you want to be careful with taking vitamin D. So that's about it. I try to keep it brief, and I try to leave some time where I could actually answer your question. So vitamin D, really important, you know, in summary. You don't get enough sun to make enough vitamin D here. You have to supplement, especially during the winter. 1,000 units of D3 per day will be sufficient. Your doctor may give you more. And if there are certain conditions or certain medications that you take, you have to be careful with taking vitamin D. So, yes, go ahead.
Yes, I have a question. I spent the first 60 years of my life in Southern California, so I never had to worry about vitamin D deficiency. I was outdoors all the time. But when I moved out here and I found a really good doctor in Bellingham, he started noticing that it was dropping, it was really getting low, and he suggested that I take at least so much every day. But he specified he wanted me to use gel tablets.
Yes.
He didn't explain why. Could you explain why?
Well, the gel caps, you know, it's an oil-based medication, so if you actually take it in oil form, there's better absorption. So that you build your levels higher, and it's also the animal-based one. So if there are any like strict vegans here, they may not want to take the animal-based one. The vegetable-based one, D2, is not as easily absorbed as D3. So our recommendation are the gel caps, because it's in oil form and better absorption, your levels come up higher faster. Yeah. Yes.
So does that mean that if you're taking a multivitamin that has vitamin D in it, is it better to take the gel?
Well, it's a really good question. It's most often, it's not what form the vitamin D is in, it's not enough. So these multivitamins usually have about 200 to 400 units per capsule. You know, the big ones may have 200 to 400 units. And that's not adequate unless you take multiples of those pills. So our recommendation is you just take the vitamin D by itself and take 1,000 or 2,000 units in a gel cap form. Yep.
I'm just wondering if you take a fish oil, like a salmon fish oil,
Yes.
would that have vitamin D as well in it?
Yes. Fish oil was actually one of the first things we noticed that it's a treatment for rickets, which is a form of vitamin D deficiency in children, and osteomalacia is a form of vitamin D deficiency in adults. So that basically means your bones are too soft because you can't absorb enough calcium into your bones because vitamin D is involved in that process. So all the Scandinavian countries that didn't get a lot of sun, they realized that if they eat fish oil, then their bones are stronger and healthier. So yes, fish oil is a good source of vitamin D. Yeah.
How often should you have your vitamin D level checked?
I think that everybody in this room, if you haven't had it checked, you should have it checked once, and then after that, you perhaps want to check it one more time. It's not really something you want to check all the time. It doesn't do you any good. It's one of those things where long-term, usage is going to help you long term. It's not like a warfarin, Coumadin level that you have to check every 2 weeks or 3 weeks. So I would say, once now at baseline, and once when you have been treated to make sure you come to a good level, and then after that you can just forget about it. You just keep taking your vitamin. Yes?
Within days of buying a 6-month supply of vitamin D3 in tablet form, I learned about the oil-based tablet.
Oh, no.
Should I ditch that and replace it?
No, I think that will do you still quite a bit of good, so I wouldn't get rid of that. I will take that, and then when you have used all of that, then maybe you can switch to a D3.
Would the dosage be the same?
Yes.
1,000?
Yes.
Thank you.
Yeah, 1,000 to 2,000 a day. Yes.
What are the fat cells doing when they sequester the vitamin D?
They just hold on to it. Yeah, it's
What's the
like,
problem?
well, yeah, exactly. They just hoard, I guess that's what they're fat cells, Yes.
I wonder if we could just switch topic just for a moment.
Yes.
My name is Maureen Buckley, and I know most of you. I'm a licensed mental health counselor, and I've also seen.
Oh, yes, that's right. It's nice to meet you, Maureen.
Yeah,
Yes.
nice to meet you too, and
Yeah.
thank you so much for coming, and thank you for
My pleasure.
your
Thank you.
talk. So, if you could just address to the community what your plans might be about psychiatric services. I know that that's not happening yet.
Yes.
And I'm really acutely aware of a lot of people who need to have some sort of psychiatric consultation or monitoring for medicine, whether it's a psychiatrist or a nurse practitioner or
Yes.
whomever. So could you just speak to that for a moment?
Yeah, I'm happy to.
Thank you.
You don't want to get me to talk about this too much, because then I get really mad at our politicians and the way they're handling the whole system, because I think our mental health system is broken. I mean, it's a national issue, but it's actually worse a little bit in Washington, and I deal with that every day, when I work in the emergency room. So we hold on to our mental health patients way too long. We don't have enough support. So to answer your question about Point Roberts, it all really depends on what kind of a type of a case we're talking about. And so I think the answer for Point Roberts always comes from a proper assessment, initial assessment, to find out, does this person, need care right now, or do we have time? Can we handle this on an outpatient basis, or do they need hospitalization? So that's a really important question to answer. So with any mental health patients that you see here, I think we need to answer that right away. Can we walk, or do we have to run, for this patient, to help them? So if they're sick, then they need to be transferred. But if we can do outpatient interventions, I think that will be awesome. So what I can foresee happening here is we work with you to do the initial assessment, and if we assume that that patient is stable to be treated on an outpatient basis, then I would say there are resources that we can tap into, including your own services here, that we can maybe keep that patient close to home. Does that answer your question in any way?
We've begun
yeah.
a conversation.
Yeah, well, we look forward, by the way, I look forward to your recommendations. I'm still finding my way around this community, trying to see what kind of things are available here. But I can tell you, it's a challenging part of our healthcare, no matter where you are. So I think that, a good triage is really the main thing. Yeah.
Thank you.
Yeah, my pleasure. Thank you. Are we on time?
I think
Did
we're
we
on
do
time,
okay?
sir.
Did I do okay?
You've done very well.
Okay, all
Thank you
right.
very much.
Well, thank you very much.
Thank you very much, Dr. Sean. Again, we do appreciate you taking the time and traveling. And we do actually have a small thank you gift. Here we go. Come back.
I get a gift. I'm not used to that.
from Circle of Care to you and to everyone at the clinic. It's a
God.
copy of our backstory. And,
This is all the juicy gossip.
Yep. I